Today, in this modern era, the advancements and technology in the medical field are so advanced that so many terrible diseases or very horrible conditions have a cure, have a way out. Let's look at cancer. I've even heard of fourth stage cancer patients getting complete recovery or remission from their condition. That even heart patients with around even 90% block in their valves, they have a solution. Even if you look at advanced liver diseases, there is a way around almost every advanced stages of disease. But let me tell you about a disease that has evaded the modern advancements in our medical field, and that is so evasive that it is very horrible for those who suffer it, and those who know about this disease fear it with their lives.
Yes.
This disease is nothing but IBS, irritable bowel syndrome.
Irritable bowel syndrome. It had been presumed as a disease of business executives and highly stressed people. Irritable bowel syndrome. Scientists so far couldn't identify any underlying cause. All investigation failed for IBS. Let it be endoscopy, scanning, blood investigations. All type of parameters and investigation turns out to be negative for IBS. And finally, doctors accuse that IBS is result of your head.
A result of your stress.
Your stress.
Or
Stress and
anxiety.
head is the cause of irritable bowel syndrome. My experience of over 10 years helped me to understand that so-called IBS, irritable bowel syndrome, no longer related to your head or stress. It's mediated by a type of bacteria. That's why I love to call irritable bowel syndrome as irritated bacterial syndrome. I don't call irritable bowel syndrome. Irritated bacteria syndrome.
So like how you said in the name itself,
Yeah,
the cause
irritated
is given.
bacteria syndrome.
Irritated bacteria.
A type of bacteria in your small intestine contribute to this condition and mediating the symptoms of irritable bowel syndrome, diarrhea, alternative diarrhea and constipation or depression.
So it is really different because we know bacteria or viruses cause colds and coughs and conditions like that, but it is really astonishing that a tiny organism can be the cause of such a horrible condition.
So the root cause of IBS is overgrowth of a strain of bacteria. And this condition today famously called as SIBO. SIBO, S-I-B-O. All of you can just Google it. SIBO, small intestinal bacterial overgrowth. The root cause, the underlying cause of irritated bacteria syndrome, IBS. Small intestinal bacterial overgrowth.
This is really amazing because it is not found in any kind of investigations. Because that is why it has evaded medical science for so long.
Definitely, yeah.
For so long.
Absolutely right.
They are suffering, and people, even the medical experts, just claims it either because of stress or maybe it is just that they are feeling it. It is just a pseudo feeling that maybe they are having this condition, or maybe it's a pseudo pain, that they are not considering it as a real problem.
Yes.
So in actuality, it is because of the overgrowth of a type of bacteria in the small intestine, you say, sir.
Yeah.
Yeah.
It's definitely, and the understanding regarding SIBO substantially helped me to handle IBS very effectively. Today, my success rate is 100%. After I learned that it's not the stress, a bacteria causes IBS. The success rate is close to 100%. Earlier, I never used to get disease. There had been some relief, symptomatic relief. I used to keep them on meditation, thinking that head is the cause. But that definitely, it might relieve symptoms. None of my patients ever got complete remission. But when I started treating from this new perspective, small intestinal bacterial overgrowth. My patients got complete recovery, complete remission of long-lasting irritated bacterial syndrome, IBS. Let's look into a couple of studies published in American journals. Let's look into study, small intestinal bacterial overgrowth, SIBO and IBS. There is a strong correlation, and this study published in American Journal of Gastroenterology, small intestinal bacterial overgrowth in irritable bowel syndrome. A study from American Journal of Gastroenterology suggests that small intestinal bacterial overgrowth in irritable bowel syndrome. So what is this small intestinal bacterial overgrowth? Let me explain. Our GI tract, gastrointestinal tract, has three segments: stomach, small intestine and large intestines. And GI tract is inhabited by tiny organisms called as gut microbes. Trillions of microbes are inhabiting our GI tract. The large intestine, the most of the microbes are in large intestine. In small intestine have relatively low density of bacteria. The bacteria in small intestines are aerobic bacteria. Large intestine bacteria are anaerobic bacteria. SIBO is the condition where anaerobic bacteria from large intestine moves upward direction, makes settlement in small intestine, makes the colony in small intestine. From large intestine bacteria, it travels to upward direction, settled in small intestine. And it is almost like they're not bad bacteria first and foremost. Those bacteria settled in small intestine are not harmful bacteria, but they settled in a wrong position. Let me tell one example. A bank. Bank manager, security, accountants. We have varieties of staffs.
Doing different jobs.
Security is a human. Accountant is a human. Bank manager is a human.
They all have their different importance.
Different responsibility. But just imagine if the security of bank sit in the chamber of bank manager and try to control the daily activities.
If he is not qualified and if he does not have the capability.
But it's not something bad. But everything get chaos. Same thing happens here.
It collapses the system.
It's sitting in the wrong place. So here good bacteria are sitting in the wrong place, which is intestine. And this condition is called as small intestinal bacterial overgrowth, which impair daily normal functionings of small intestine.
So this is a very new take on this condition, and we understand that it is not bad bacteria. They are very useful bacteria, but it is just that they are misplaced, that they are in the wrong area of our body, and they are not able to do their helpful work for us, and they are hampering the good work of the small intestine itself. This also creates a kind of depression.
Let me explain the depression aspect of IBS. Diarrhea or loose motion and depression coexist in IBS patient. Both are like two sides of a same coin. Depression accompanied by loose motion. The classical hallmark symptom of irritated bacteria syndrome. I always forget to tell irritable bowel syndrome. Irritated bacterial syndrome. The small intestinal bacterial overgrowth prevent reabsorption of a hormone which is usually produced in GI tract called as serotonin. All of you must have heard multiple times serotonin, which is a happy hormone supposed to be in brain. But do you know one mystery? 90% of serotonin, happy hormone, is produced in
the
intestinal tract, GI tract, gastrointestinal tract. Later, the hormone is transported to brain, where it serves as brain hormone. So I'm reminding you, the serotonin, 90% of serotonin is produced in intestinal tract.
So as we always know, gut bacteria, like we told, it's not a bad bacteria, it's a good bacteria that gives us proper functionings. It gives us happy hormones. It gives us the processing of vitamins. It gives us processing of our stools. Normal, healthy process in our body. But when it is in the wrong place, it is not able to do the proper functions, and so many normal things in our body go into disarray.
Yeah, the serotonin, the brain hormone, produced in intestine. So it has to reach to brain. From
the intestine.
Production is in intestine, but destination is brain. How to reach here? There is a type of protein, carrier protein.
That
which
carries
is,
the serotonin.
Yeah, which is like a carrier vehicle, transport vehicle. Bind to serotonin, takes it to brain and put it in brain.
Put it in the brain.
And where it serves as a brain hormone. It's worth it to note that serotonin has one more function, peristaltic movement.
Peristaltic
Yeah,
movement.
the serotonin is the hormone with the two mission. The primary mission is movement of
the
intestine tract, GI tract.
For those of you who don't know,
the bowel movement.
Peristaltic movement is the movement that is the healthy movement that transports your stool. It's like a snake-like movement. It helps your stool to pass through, and this is how you get your daily motions. In the morning,
daily
when you go to
motions.
your bowel movements, if you clear your bowel movements very easily, it is because you have healthy peristaltic movements. So, serotonin is the hormone that first induce
the peristaltic movement. Soon after inducing the peristaltic movement, it is taken to brain by transport protein, where it serves as brain hormone.
As a happy hormone.
So this is major two aspect of serotonin. First is the peristaltic movement. In IBS, the mechanism of IBS is nothing but the serotonin is not moving to
the
brain. So it accumulates in intestine. And excessive peristaltic movement, the primary mission of serotonin is peristaltic movement. So when you have too much serotonin,
the
peristaltic movement is more. That leads to loose motion.
This is really wonderful. So it is a very easy, very easy underlying cause.
Yeah.
Because it has evaded modern medical science for so long, but in the end, when we look at it, it is a very simple cause, and we are able to understand why doctors think that stress is causing this condition, because this condition causes
stress because serotonin is not reaching to brain.
So it causes depression.
So your Madhya Pradesh cause the trouble in Uttar Pradesh. When you have a smiling Madhya Pradesh, you have a
more
happy Uttar Pradesh.
So it is just
opposite happens here.
Yeah,
so it's not your head cause the stress, the gut cause the stress.
It is a beautiful explanation, and I think this is very helpful for a lot of you. And please elaborate more.
Yeah, so SIBO, small intestinal bacterial overgrowth, prevent reuptake of serotonin to brain. So the culprit is SIBO. So if you remove the SIBO, if you counter the SIBO, definitely this process can be regenerated.
You are able to feel that as if this is not a complicated task at all.
Not complicated. All you have to do is attacking this notorious bacteria in your intestinal tract, small intestinal bacterial overgrowth.
As you have been saying, you have been treating this disease for so long. So can you please tell us more about your method of treatment?
So I have developed a triple therapy. So the best formulation, I have been formulating different protocols since 1.5 decades. My most successful protocols are 2 triple therapies, or you can say 3 triple therapy. 1 triple therapy for gastritis, second a triple therapy for intestinal disorder like small intestinal bacterial overgrowth and IBS, third triple therapy which had been very success rate, a triple therapy for constipation. And even the IBS, I had developed a natural triple therapy. Triple therapy for small intestinal bacterial overgrowth, which consists of 3 elements. The first is diet, second is probiotic, third is natural herbs.
Diet,
probiotics,
natural herbs.
Diet, it's anaerobic bacteria.
Anaerobic means those bacteria that lives without the help of oxygen. It needs nutrients. So we all are aerobic. We need oxygen as well as nutrients.
as well as nutrients.
Those that are anaerobic do not need oxygen, but they are thrive on energy is only through nutrients.
Nutrients, yeah. So anaerobic bacteria, as name indicates, they can survive by glucose and fructose,
Glucose
sugar and fructose,
sugars.
anaerobics, not in presence of oxygen. In presence of glucose, they can thrive and multiply. So therefore, I designed a diet devoid of glucose and fructose,
So you are just basically starving them.
starving them. And second, herbs,
Herbs.
natural antibiotics. There are numerous incredible herbal antibiotics from Indian subcontinent, which all had been proven by research, can counter small intestinal bacterial overgrowth. So I have made a kashaya, a churna, consists of 15 extracts of natural antibiotics, herbs extracts, very powerful. And third is probiotics. I do have a type of probiotic called as SBO, soil-based organisms. Soil-based organisms. They are not conventional probiotics. They are isolated from soil. So these are the three protocol I had been implementing to my patient with 100% success rate for diarrhea-dominated IBS. And I seen 15 days to 1 month complete recovery from
15 days.
15 days to 1 month, complete recovery from symptoms of IBS, particularly loose motion. The motion and bowel movement get fixed in just 1 week to 10 days, and subsequently depression vanishes surprisingly.
So it is an amazing therapy, an amazing treatment. It's very simple when you look at it. Good bacteria, a good diet, which we try to starve the overgrown bacteria, and antibiotic herbs, natural we stress on natural herbs because they are very specific. If you try to have broad spectrum antibiotics, it kills good and bad bacteria. So what we are trying to do is to specifically target the bacteria that has overgrown into the small intestine, as the name suggests, SIBO, and we are trying to eliminate only the ones that we need to eliminate. So I think this is a beautiful treatment course, the natural triple therapy. Thank you, sir, for sharing your valuable time and your beautiful protocol with us. Thank you, everyone, for spending your time as well. I hope that this video was helpful for you, and please do share it to your friends and family, for you might not know who might be in dire need of this information. As I said, this is a condition that is very, very horrible, and people think that they don't have any cure or any hope. It is not very common in all the hospitals for this IBS condition. But as our doctor has shown, it is a very simple condition that can be tackled easily, but through the right methods. So thank you, everyone. We'll see you next time.